Good morning and welcome, everybody. I'm Susanna DeBaca, the president and group publisher of Business Publications Corporation, which is the parent company of Business Record, which since November has been bringing you Fearless. We are delighted that you are here today with us as we all work to be more and fear less, with today's focus on a topic that is near and dear to my own heart, which is healthcare. In a few minutes, you're going to be hearing a little bit more about Fearless and about the program today. But first, I want to take a moment to reflect on women and healthcare by highlighting an Iowa woman that everybody here today should know. I want to introduce you to a woman named Gwendolyn Wilson Fowler. You may not have heard of her, but in 1930, Gwendolyn was the first Black woman pharmacist licensed in Iowa. After she got her pharmacy degree, unable to find employment in her profession, she devoted 15 years to teaching school before being able to realize her goal of being a pharmacist. From 1945 to 1955, she was employed by the state of Iowa, but first as a pharmacist's clerk. In 1960, she resumed her career as a chemist in Des Moines and retired in 1974. She was a charter member of the Junior NAACP. She started in 1920 and a member of the Kappa Alpha sorority, and she was inducted into the Iowa Women's Hall of Fame in 1982. So you might be saying, why am I bringing up Gwendolyn Wilson Fowler and why is she relevant and noteworthy today? Well, first of all, it's Black History Month, so I always like to highlight and honor Black women. But there's a couple of reasons why I'm bringing her up around healthcare. First, it was very unusual in 1930 for any woman, much less a Black woman, to obtain higher education, certainly in a science or medical field. Secondly, you might have noticed she delayed her career. It's common still for women who are trained in advanced fields to have difficulties finding a job in that field. Many, like Fowler, and I think we all know the story of Ruth Bader Ginsburg, start out being a clerk or doing something first before working their way up to perform the work that they're actually qualified for. This still happens to many women today, and this is a subtle form of discrimination. Thirdly, I bring up Wilson Fowler. She is relevant because, as always, pharmacists play a key role in the delivery of healthcare. And today, giving COVID-19 vaccination shots to men and women alike is a vital role in our recovery from this pandemic. Women like Wilson Fowler paved the way for other females in health-related professions. Today, more women than men actually graduate from medical school. But regardless of gender, we are grateful for everyone in healthcare: pharmacists, doctors, nurses, physician's assistants, administrators. Anyone who works in healthcare deserves our gratitude for their role in this very, very important profession. Healthcare is truly central to our lives as women, including our regular health care, the unique reproductive and sexual health care needs we have as females, and our mental health. Our physical and mental health are key to us leading productive lives and having the strength and the clarity to achieve in our careers. And our reproductive lives often have deep impact on the choices and the directions that our lives take. Unfortunately, women's health is under siege in many ways today. While women have made stride in medically related fields, we are vulnerable to disease and we often lack access to affordable health care. COVID-19 is just the tip of the iceberg. And in Iowa, lack of access to care is compounded by provider shortages, especially in rural areas like we have here in the state. maternal and mental health care access are also at crisis levels here in Iowa. Each one of us has our own healthcare story, our own health journey, and probably somewhere along the way, our own health challenges. I am passionate about women's healthcare of all kinds, so I could not be more excited that we're addressing this critical topic here today. Equally passionate about healthcare and women's issues is Emily Barsky, the editor of the Business Record. As I told you last month, and you may know, Emily joined the Business Record a year and a half ago, and she was recently promoted from associate editor to editor. I cannot tell you how proud I am of Emily's leadership of Fearless, along with the other Emily, Emily Blowbaum, and the rest of the Fearless Business Record team that makes this possible. And so I am now very pleased to introduce Emily Barsky, who will give you an overview of today's program and a little more background on Fearless. Thanks for being here, and over to you, Emily.
Thank you, Susanna, and good morning, everyone. We're glad you joined us for Fearless Friday. Just wanted to give a few quick technology tips. If for some reason we lose our connection or Zoom shuts down, you can just come back to the event through the same link that you used to get in. It's also best to use gallery mode so that you can see everyone else when we're in our breakout rooms. If you have any questions related to technology or throughout the program, please feel free to drop those in the chat at any time and our staff will be happy to address them. I don't know about how it's been for you all, but time has really seemed to both fly by and drag on throughout the pandemic. So it seems like Fearless has been around forever, but we just launched in November. So we created this out of a simple goal to empower Iowa women to succeed in work and life. It's our belief that women's issues are everyone's issues, and we present them as such through Fearless, and want everyone to be welcome within our conversations. We believe connecting our audience is key to Fearless. Our hope is that as you read our newsletter each week, you'll find something that's of particular interest to you and in-depth content that helps you learn about something new or understand a different perspective. Then when we come together at the end of each month, we want to give you the chance to talk about it and meet others equally passionate about these issues. And that's really the goal of our Fearless Friday series. So we're glad to see that many of you have returned from our first event in January, and we're also happy to see some new faces here today. Through Fearless, we want to have discussion of timely topics, but we also want to ensure that we focus on many of the issues that affect women. So we've selected a monthly theme from those that we heard in our surveys and focus groups that people really felt were most important to them in regards to women's issues. So this month's focus has been on healthcare. We'll start today with hearing from our three speakers, and then we'll go into a couple of small group discussions. You'll want to stick around to the very end because we have a drawing for a Fearless Prize. And I have one ask for each of you as we go throughout this morning. I want you to, as you listen and talk to others, I want you to think about someone you believe would find value in being here with us, because we want you to invite them to be part of Fearless for next time and with the newsletter and all of our other pieces of this initiative. I also want to make sure that you get to know Emily Blowbaum. She is the engine behind our coverage on women's issues. We're excited to formally announce today that she is now working for a company in a full-time capacity because we felt it was really important to have significant resources behind Fearless and other human interest initiatives. Those of you who have seen her work know that she's a great storyteller and brings her background in visual journalism into everything she does. As a Fearless editor, she puts together the e-newsletter each week and provides original in-depth reporting. Join us in congratulating Emily, and she's going to kick off the program by introducing our first speaker.
Thank you, Emily. I'm excited to introduce our first speaker. Her name is Lydia Wolken, and she's a rural sexual abuse advocate at Access, providing services to Marshall and Tama counties. She's an LBSW with a degree in trauma-informed social work. Her passion for this work stems from growing up in a rural area and seeing a need for services in the area. So Lydia, welcome.
Hi, Hi, thanks for having me this morning. I'm really excited to talk a little bit more about access and what we do when it comes to healthcare. I'll give you guys just a quick overview of what advocacy is. I'm sure a lot of you are familiar with it, but sometimes people aren't. Just providing some victim service advocacy to our service area for access is Greene, Boone, Story, Marshall, and Tama counties. So a long line of counties along Highway 30. And our involvement with healthcare often comes in the shape of a SANE exam taking place with a survivor. So when these exams take place, that's something that we have what we call a SART team, which is a sexual assault response team, which is made up of different people depending on where you are in our service area, but always an advocate. We would get dispatched by a provider, whether that is the hospital themselves, law enforcement, the SART team itself in Story County, to respond to this healthcare setting to provide advocacy and support for survivors in real time during their SANE exam. Or if they choose not to do a SANE exam, but are seen for other medical issues that are involved or have been, come of an assault, we would come to that as well. When it comes to the exam itself, we are there not to be a medical professional, but to be a support system for that survivor in that moment and provide support, insight, and at the end of the day, advocacy for anything that they need to make sure that they are heard and seen and supported throughout the entire process. It's a very personal process to go through. They're going through one of the toughest things they've ever been through, and now they are expected to tell the story to different people to get the help that they need. And if we're able to be there and be a voice for them or answer questions, ask questions, kind of be a middleman liaison between them and other resources that they need, that's something that we want to be able to provide so that they can focus on their health, their needs, and what they need to do to get through this moment, and we can try to do that hard stuff for them, or at least alongside them. Things can look different based, case to case, depending on what's going on, where we are, what the survivor's needs are. But often it is explaining some options, like I said, being kind of that liaison, providing resources in that moment. If a survivor has experienced an assault and now they are needing some housing resources, that's something that we do through Access, where we get someone that was on call on the other line saying the survivor's in this county and they need these resources, and that's a safety priority at this time, and we'd start working to figure that out. It's also really common that we provide support to parents of minor children that have been assaulted and are now getting this exam. We provide support to people of all ages, but when those kids are being seen, a lot of times parents are providing support to them and being that person for them, but then that leaves the parents without the support themselves. So there's all the hustle and bustle of, a SANE exam happening, and they're in, if their child is really young, they might be in blank ER and it's a new space and they're not familiar with it. And we're able to be there so that they can support their child and we can support both of them in turn. That way their focus can be where it needs to be. Getting shelter team involved, like I said, is often a common need for supporting survivors as well. And that's just something we're happy that we're able to provide too, because then that again takes one of those fears off of the table for survivors, and they're able to focus on what they need to focus on. We often spend time doing trainings and collaborations with other medical professionals to make sure that they're informed on our services and we're informed for them. We want to make sure that we work as a team to provide the best care to survivors, and the only way we can do that is by collaborating with each other, keeping up to date on what's going on, especially during these times. It's been very different than it has been in the past, but we're making it work to make sure that at the end of the day, that medical advocacy is still an option for survivors. I'll talk a little bit too about why I do what I do. Like Emily said when she introduced me, I grew up in a very rural area, the same area that I serve now, and seeing these needs not being met in this capacity was a big reason as to why I wanted to come back to the same area after I finished school. And eventually I'd love to further my education and continue to do more, but I knew that coming back to that root area where those issues are not being addressed or were not being addressed was very important to me. It's such a rewarding and fulfilling spot to be in between the difference between trauma and fear and healing and safety. You get to help bridge that gap in one of the most crucial points in people's lives, and be there at that medical site, at that law enforcement, wherever it might be that they're making that initial report, wherever is safest for them. You get to work with us no matter what, no matter where you are on your healing journey, and we're going to support you through whatever it is that you need. Having been on the other side and being in the position that a lot of the survivors I work with have been in the same area, just made me that much more passionate about it, and made me want to be able to provide the support and services that I didn't have, that I want everyone to have. So that's a little bit about me. I hope that was helpful in learning why advocacy is important in the medical field and how we help survivors through that. And I really appreciate being able to give you guys some information today.
Thank you, Lydia, for all the work you do, and for helping and for being here this morning to talk to our audience. Our next speaker is Dr. Aneesa Afroze, the infectious disease consulting physician, president of medical staff, and director of antimicrobial stewardship at MercyOne in Des Moines. As you might imagine, she's been incredibly busy throughout the last year, so she pre-recorded her remarks. We asked her to speak openly and honestly about what it's been like to treat COVID patients and work throughout the pandemic.
Good morning, everyone. Thank you for having me on your show today. This is a recorded presentation. I was asked to talk for a few minutes regarding my pandemic journey, the COVID-19 pandemic on front lines. I am an infectious disease provider, and I have been taking care of it ever since the first one landed in our hospital. It has been a journey not many people living today have ever experienced, not would want to. A journey that has taught us many life lessons, some good and some very traumatizing. I would say early in course of pandemic, there was a mix of emotions and a sense of responsibility to take care of the sick and vulnerable, because that's what we do every day. In it was a fear, a mix of protecting yourself, protecting your staff, protecting your family, not knowing what's going to happen the next day. Later in course, after about a year or so, it became very traumatizing to some of the people who have been experiencing death and sickness related to this disease every day. Part of the depressing thing is the inability to take care of some of these patients who are really sick, and most of them are dying alone with perhaps just a couple of nurses beside them. Dying alone had become a norm during this pandemic. I would say some of these patients who were really very sick and not on the ventilator and were able to communicate with me, I made a point to spend a few more minutes with them. However, when you spend some time with them and you give them hopes, only to find out that they didn't survive that night, it is heartbreaking. And one such incident happened to me just recently, a few weeks ago. A patient who I interacted was talking to me. He was needing high oxygen, so he was in the ICU. And he talked to me about watching this football game that evening. And I kind of chatted with him, telling him that, oh, you got some plans just laying down here in the ICU. And he did look better than the previous day. Few hours later, early morning, 3 a.m., I get a call that this patient has passed away. And it was heartbreaking. I could not imagine that it was that patient that I got the phone call. I will tell you, this is the truth of the pandemic. We do not know who will survive and who will succumb to this disease. It takes us several days to overcome each and every incident as such. People say we get desensitized to death, but we really don't. I have never seen what I have seen this year with my colleagues, with especially the brave nurses at bedside. The tears in their eyes when they talk about the patients who were in the ICU for a month and later passed away. They've been taking care of them several days that month. When I say pandemic fatigue, and when I say we are in more need of normalcy, it is true. It is true that we also want to sleep all night without thinking about what's going to happen the next day. We want to be able to take care of ourselves and our families just the way we used to before this pandemic. Many people, including me, have lost one or more family members or friends. There will be thousands and thousands of families with empty chairs forever. This is the truth of this pandemic. The emotional toll that takes place, many people don't vocalize, but they will remember these experiences rest of their lives. This pandemic has changed the face of healthcare, has and will change medicine for decades to come. Threat of emerging infections is not new in my world of infectious disease, but a pandemic of such scale, I don't think we have ever imagined. This pandemic has broken the most brave, the most resilient healthcare workers. Many organizations around are trying their best to support and care for these caregivers. Several mental health resources and coachings are available free of cost. If only these folks can take out some time for themselves, self-care. But there is not much time left after work and after taking care of your families. But it is very important, especially at this time when we need to take care of ourselves. I urge people not to ignore the realities and the devastation of this COVID-19 has caused in our country and all over the world. Protect yourselves and your families. We are here to take care of you and your families. Please vaccinate yourself when vaccination is available to you. We need to stop and cut this chain of transmission. The longer the virus remains in the community, the more it will mutate, the more contagious variants will come. We need to cut this chain of transmission and stop it right now. Only then we will decrease this death toll. Only then our sad stories will end. And only then we all will start on the road back to recovery. Thank you.
Thanks to Dr. Afroze for taking time from her busy schedule to help deliver those remarks. And thank you to all of our healthcare workers who are treating COVID patients. Next, we have Dr. Nalo Johnson, Division Director for Health Promotion and Chronic Disease Prevention at the Iowa Department of Public Health. Among other things, she oversees maternal health for the state and is the first woman of color to do so. This is particularly important because Black birthing people in Iowa are 6 times as likely to die from childbirth than their white counterparts. Dr. Johnson is also a very busy woman, so her remarks are also pre-recorded.
I'm Dr. Nalo Johnson. I am the Division Director for Health Promotion and Chronic Disease Prevention at the Iowa Department of Public Health. So my PhD work in American Studies centered on how communities could come together to address a spectrum of needs in underserved populations and utilize coalition building methodologies in order to meet those needs. I went into graduate school expecting to spend a life in academia. However, I became increasingly interested in how best to address community health needs. And by the time I graduated, I knew that I wanted to be in the field, that as a practitioner, I could truly serve my community in ways to ensure their needs were better met. So I've spent the majority of my career in the public sector at both state, county, and municipal levels, working on community health and public health efforts. And I can say what ultimately attracted me to public health was the ways in which I understand public health to be a social justice tool. That public health provides us a framework to understand where and how disparities may exist in communities, and that public health calls upon us to look at our data, identify where health disparities exist, and build specific solutions to address those disparities so that overall our rates of positive health outcomes may increase. And in turn, we're also seeing better health outcomes in our underserved populations. Thus, public health is a data-driven understanding that if you want to see a healthy and thriving community, you need to ensure you are addressing the health disparities among the various populations in your community as well. So I'll provide a very specific example to illustrate what I'm talking about. Women of color in the US, and Black women specifically, continue to experience greater rates of maternal mortality and severe maternal morbidity than white women. Recent studies will point to a 2 to 4 times greater rate of maternal mortality nationally. And in Iowa, we have these similar trends with our 2020 maternal mortality review report, finding that Black women in Iowa were 6 times more likely to experience maternal mortality than white women in Iowa. And this is not a new concept. Data has shown for a long time that Black women were disproportionately experiencing these negative health outcomes. But in recent years, public health has helped change the conversation as to why this disproportionality was occurring. So research has arisen acknowledging the effects of weathering on Black women's health, or the understanding that the compounded effects of racism physically and mentally impact the health of people of color and materialize in things like high blood pressure and chronic stress. Additionally, from a social determinants of health perspective, understanding that women of color earn less in comparison to white women, which impacts their ability to obtain housing that may be in areas with easy access to things like grocery stores with highly nutritious food options, as well as safe spaces for physical activity, or impedes their access to reliable health care through their employers. And finally, understanding that bias within the healthcare system itself, whether implicit or explicit, leads to women of color not receiving appropriate and respectful levels of care when seeking healthcare services. Rather than continuing a misdirected conversation of blaming the individual behaviors of Black women, public health is working with Black community organizations and Black health professionals to understand and articulate the systemic nature in which these health disparities are occurring and develop solutions to improve these health outcomes. And we're doing such work right here at IDPH. So in my division, I oversee 4 bureaus, including the Bureau of Family Health, which administers the state's federally funded Title V maternal and child health program. In 2020, looking at our data, we sought to develop interventions to decrease the disparities we have found within Black identified maternal health population. So working with Iowa's Black maternal health professionals, including the Iowa Black Doula Collective and researchers at the University of Iowa, we've crafted a culturally congruent, community-based doula program to offer as an additional service at our Title V agencies, serving the largest proportion of Black identified clients, including here in Polk County. This project would seek to pilot the use of the doulas and track specific health indicators, including things like initiation of prenatal care in the first trimester, as well as breastfeeding rates, in order to evaluate a reduction in maternal health disparities among our Black population, as well as craft the potential ROI for Medicaid and other health insurers' consideration for the reimbursement of doula services. So I'm currently seeking funding to implement this project which would prove to create positive systemic change in Iowa's maternal health landscape. So back to my point of public health as a social justice tool, the ability to use data to identify where the disparities exist and work with community members themselves to develop and implement solutions to address those disparities, that to me is how you accomplish true equity work with tangible outcomes within a community. So when I go back to thinking about the areas that interested me as a kid growing up in Iowa, of that desire to understand how we're building community with one another, how we're working together to address a need in our community, of my particular desire to serve my community, it does not surprise me that I have found my place professionally in public health. This field, when appropriately practiced, provides a strategy and a language to identify inequities within a community, offer up evidence-based best practices as solutions, and evaluate results in order to speak to community impact, as well as inform investments as to where resources would best be spent. So as I tell my team members and my colleagues, I ascribe to multiple identities. I'm a wife, a mother, a woman of color, a trained academic, a public health practitioner, and a proud Iowan. And I'm thankful that I have the opportunity to serve community members both at the local and the state level through the lens of public health.
Thank you, Dr. Johnson, and to all of our speakers for taking time to talk with our fearless audience this morning. Now we're going to transition to the discussion part of our program, and we'll be transporting you into breakout rooms. As you get into the discussion, keep a few things in mind. We all have different life experiences and viewpoints, so it's okay if you disagree with someone, and it's okay to say so. We just ask that you do so respectfully. If your conversation gets somewhat off topic, that's okay. We just want you to have a meaningful discussion about these issues and connect with each other. Please introduce yourselves to start off and give everyone a chance to weigh in. We'll be transported into those breakout rooms here soon. Welcome back, everyone. We're excited. We hope you had some good conversation and learned something from each other. So we want, after that discussion and before we get to our next one, I want to give Emily Blobbaum a chance to talk a little bit about what she's gotten to cover in Fearless this month and some of the things that she learned. So Emily.
Thank you, Emily. Obviously, the topic of healthcare is massive, and there were so many aspects of it that we weren't able to cover this month. But I want to talk a little bit about two areas of healthcare that we did address, those being the ongoing COVID-19 pandemic and the Black maternal mortality crisis. So as I reflect on the year that we've all endured, I often think back to the months of March and April when, people were back in New York City every evening. At 7 p.m., people would lean out of their windows and make lots of noise in a show of support for healthcare workers. And I think about the songs that would play on hospital speakers when COVID patients were discharged. And I think about the signs in people's front yards that said something along the lines of, a hero lives here. But then I think about how quickly that all dissipated. The initial feelings of fear that people were experiencing seemed to turn into anger, frustration, and impatience. I too was guilty of that. I was tired of getting the push notification from the Des Moines Register every morning that stated the number of deaths and positive cases here in the state. I was tired of the world feeling heavy. The news cycle moves incredibly fast these days, and by the summer, it seemed as though the pandemic had been placed on the back burner. It was still a crisis and a big story, but journalists, including myself, had moved on to dedicating time and space to racial and social justice issues. Then there was the derecho, then it was the election. 2020 was overwhelming, to say the least. By the time November rolled around, hospitalizations and positive cases were skyrocketing. I knew I had a responsibility to help bring COVID back onto the front page. But I'm not a healthcare reporter, so I wasn't going to be able to add anything that the talented reporters across the state weren't already doing. I thought back to those healthcare hero signs and spent some time thinking about what it must be like to not have that luxury of setting the pandemic aside. I reached out to a source at MercyOne and asked if I would be able to talk with a few doctors on the front lines of the pandemic about what it's been like for them personally. I had a notebook page filled with questions about how they were feeling mentally. I was put in touch with Dr. Sydney Leach, who is the Associate Medical Director of the Emergency Department, and Dr. Afroze, who you heard from earlier. I talked with them for hours through Zoom, over the phone, in person, and at the hospital. And then these pictures here are of them at the hospital. When we spoke shortly before vaccines were being distributed, both of them were hopeful and had a sense of optimism, but it was clear that they were also exhausted. When I spoke with Dr. Afroze in November, she told me that she hadn't taken a vacation since early March and would often work 21 days in a row. And as she mentioned in her remarks, there's also concern about the lasting mental health effects, especially because there's no time for them to pause and seek help right now. So as we move back to a sense of normalcy, hopefully sooner rather than later, it's important to understand that healthcare workers may never go back to feeling normal. The other big story I worked on this month was about Black maternal health, and in particular, the Black maternal mortality crisis. I first heard the statistics that Black birthing people were 3 to 4 times more likely to die from childbirth than their white counterparts back when I was in college. Years passed, and while I never really forgot about it, once again, I didn't feel that I could add anything worthwhile to the conversation that wasn't already being reported. But the minute I was brought on to help lead Fearless last summer, I knew that this would be my opportunity to help shed light on the disparities here in the state. Much like we do with all of the articles here in Fearless, I wanted the main focus of the piece to highlight what's being done to address it instead of focusing on the statistics. I talked with Olivia Samples on the left, who is a non-binary holistic doula that specializes in serving Black and LGBTQ folks. Olivia is currently in the process of planning a virtual conference taking place during Black Maternal Health Week that's centered around the joy of Black parenthood. I also talked with Dr. Johnson, who you just heard from, and Dr. Lastasia Coleman, who is the only Black midwife in the state. They all listed several solutions to driving down the maternal mortality rate and emphasized that addressing the issue really requires innovation across all levels of community leadership and healthcare. Some of the solutions they mentioned include raising awareness, welcoming new perspectives, addressing medical and systemic racism, and supporting midwife and doula practices. My story goes further into that, so if you haven't already, please take a moment to check it out. But my time is just about up, so I'll turn it back to you, Emily.
Awesome. Thank you, Emily, for all your coverage on that. And again, I hope you all check that out at businessrecord.com/fearless for all those stories if you want to check them out. So we'll go into our next breakout room. This question will be, what is a healthcare innovation that you think will be particularly helpful to women? So we'll go there in a second. Welcome back, everyone. We hope you had some good discussions and learned something new from hearing each other. As we close things out, we want to give you a sneak peek at what's coming up, and then we'll finish the morning by doing our drawing for the Fearless Prize. So our next Fearless Friday is set for 8 a.m. on March 26th. And as a reminder, we hold these at one Friday each month, and March focuses on leadership. So we'll introduce you to female leaders across the state, and we'll focus on gaps in representation, as well as challenges female leaders face. We hope you'll join us. And if you've signed up for the series today, you'll automatically get the information to join, and you don't need to re-register. If you signed up for the event today, then you're good to go, and you don't have to do that again. If you think someone would be interested in being a part of the Fearless community with us, we encourage you to have them sign up for the newsletter to invite them here for our next event. And if you want to subscribe, you can do that at businessrecord.com/fearless. If you want to share any story ideas, be sure to get in touch with Emily Blowbaum, and her email is up there. And she can, you can share any ideas with her, or if you have any feedback, please be sure to share that with her. And then if you're interested in advertising and sponsorship, we're a locally owned media organization and strive to support our communities. So if you want to help support us, you can get in touch with Sarah Brown about sponsorship opportunities. So to get into our Fearless Prize, we're giving away a shirt today. So not only can you choose to live fearlessly, but we want you to show it too. So you can be sure to get any of our swag. To give away our prize today, our winner is Sarah Wilson. So congratulations to Sarah. We'll get you, we'll be in touch with you and get the shirt to you. And if you want to help spread the fearless spirit, you can go to our swag site. Congratulations to our winners, and thank you all for spending time with us this morning. We hope you have a great Friday and a great weekend.